Hi! Hi second year! So, welcome back sa aking channel. Yes. So, for our topic for today, we'll be discussing Miscellaneous Protozoa. So, ito na po yung last topic natin for finals. Yan. So, sana pinanood niyo po yung mga previous na ating lecture kasi po malapit na po ang ating finals. Yan. So, let's start. So, for the classifications, we have the ciliates. So, from the word itself, ciliates, so they have cilia. Yeah. Alam naman natin yung cilia, they are a hair-like structure that helps the organism to move. Yan. So, from phylum, Ciliophora, and class Fragminophorea, we have the intestinal species, which is the Balantidium coli. Next classification, we have the Sporozoa. So from phylum Apicomplexa as Sporozoa, so we have three intestinal species and one tissue species. For intestinal species, we have the Isospora belli or belli, the Sarcocystis species, and the Cryptosporidium parvum. And for tissue species, we have the Toxoplasma gondii. And for our last classification, we have the Blastocystis hominis. And from the phylum Blastocystida, class Blastocystea, and now we call the intestinal species the Blastocystis hominis. Okay. So for our first topic, first parasite natin for today is the Balantidium coli. So common associated disease and condition, it is also the name of the sickness is called balantidiasis. So, katulad ng nabanggit ko kanina, yung ating Balantidium coli, they have cilia structure in the organism. Kung so, kung napapansin nyo dun sa GIF natin, yan, umiikot siya. Then, kung titignan mo siya mabuti, meron siyang hair-like structure that helps it to move. Yan. Kita ba? Ganito rin dito sa picture na hindi naman po gumagalaw. Mas kita siya na meron po siyang mga hair sa labas. Yan. So, yun po ang cilia. Okay, let's talk about the morphology. For the size range of the trophozoid, 28 to 150 micron in length and 22 to 123 micron in wide. The motility of the trophozoid is rotary or boring. The number of nuclei is 2, and it has kidney-shaped macronucleus and a small spherical micronucleus. In other features, 1 or 2 visible contractile vacuoles, cytoplasm may contain food vacuoles and or bacteria. Its small cytostome is present and layer of cilia around organism can be seen. Yan. So kung napapansin nyo, yan, yung picture po sa baba. Yan, so pinakita po yung macronucleus. Yung small spherical micronucleus hindi siya kita, so probably hindi siya na-stain ng maayos. Yan. And this one, yung medyo pahaba po, it's also a trophozoite form. Pero kung dito mo napapansin nyo, mas kita, mas malaki po yung kidney-shaped macronucleus. Next natin, we have the Balantidium coli cyst. So the size range is 43 to 66 micron. The number and appearance of nuclei, it has 2 nuclei. Kidney-shaped macronucleus usually present and small spherical micronucleus may not be observable. So hindi siya masyado nakikita. Katulad din nung nabanggit natin kanina sa trophozoite. Other features, 1 or 2 visible contractile vacuoles in young cyst, double cyst wall, row of cilia visible in between cyst wall layers of young cyst, and mature cysts tend to lose their cilia. So once po ang ating cyst po ay nag-mature na siya, minsan nawawala na po yung cilia. So isa sa pinaka maganda rin na diagnosis natin is makita natin yung young cyst kasi sila po yung merong cilia. Ciliated pa sila. Yan. So, kung napapansin nyo sa picture, parang wala na siyang cilia talaga. Tapos, tulad na nabanggit kanina, we can see the kidney-shaped macronucleus. Ayan. And a small spherical micronucleus. So, specimen of choice, stool. Para makita po ang trophozoite, the stools from infected patients experiencing diarrhea. So, yung stool po ng patient na nagda-diarrhea, yung basa, malambot, yan. Usually po ang makikita doon ay trophozoite. Pag cyst naman po, usually makikita siya sa formed stool. So, buong tae po. Yan. So, pero pwede rin naman po gumamit ng ibang specimen. So, we can use sigmoidoscopy material. Yan. So, when collected from patients suffering from sigmoidorectal infection, thorough screening of the wet preparations and the permanent stain is crucial to ensure an accurate laboratory test report. So, study of multiple sample may be required to determine the presence of or absence of the parasite correctly. Yan. So, yung nasa picture po is example ng sigmoidoscopy. Yan. So, pinapasok po yung camera sa loob ng puwet po ni patient. Then, makakarating po yung camera yun hanggang sa colon po ni patient. Then, yan. So, titignan po. Yan. May video monitor. Titignan po ng doktor na gumagawa ng procedure yung itsura po ng colon at the moment. Yan. Next natin is the life cycle. So, follow po natin from the host most often acquires disease through the ingestion of contaminated food or water. So, ito pong Balantidium coli, usually po nakukuha siya kapag nakainom tayo or nakakain po tayo ng contaminated food or water. So, following ingestion, excistation occurs in the small intestine and the trophozoites colonize the large intestine. Yan. So, the trophozoites reside in the lumen of the large intestine and appendix of human and animals where they replicate by binary fission during which conjugation may occur. So, kung titignan niyo po, andito na tayo. Yan. So, nagkaroon po ng binary fission. After that, magkakaroon na po ng encystation to produce infective cyst. Yan. So, once na po na merong infective cyst, magtutuloy-tuloy na po yung life cycle. So, some trophozoites invade the wall of the colon and multiply, causing ulcerative pathology in the colon wall. Some return to the lumen and disintegrate. Mature cysts are passed with feces. So, epidemiology, distributed worldwide, and outbreaks have been known to occur. Typical incidence of human infection is very low. Infections of B. coli in United States are found in psychiatric wards. Ingestion of contaminated food or water by fecal-oral route, person-to-person route, usually found in food handlers o yung mga taong po na nagpre-prepare po ng ating mga pagkain. And the reservoir host for this parasite are the pigs. So, for our clinical symptoms, pwede po na asymptomatic yung ating patient or magkaroon po talaga siya ng parasitic infection which is what we call as balantidiasis. So, for asymptomatic carrier state, so similar to that seen in certain patients infected with Entamoeba histolytica, some patients are just carriers of B. coli and remain asymptomatic, while the persons who have balantidiasis, the patients are suffering from mild colitis and diarrhea to full-blown clinical balantidiasis and often resembles amoebic dysentery. So abscesses and ulcers may form in the mucosa and submucosa of the large intestine, followed by secondary bacterial infection. So acute infection, So usually po ang patient 15 liquid stools daily containing pus, mucus, and blood. So yung pupo po ng patient na may acute infection of balantidiasis, 15 liquid stools with pus and mucus and blood. So isipin mo na lang kung gaano kasakit. Paano pa kaya kung meron kang chronic infection? So, in case of chronic infection, the patient will experience tender colon, pamamaga po ng colon. The patient will also suffer from anemia, cachexia, and occasional diarrhea alternating with constipation. And also, the balandidiasis can invade other parts of the body. So they can invade the lungs, the livers, the pleura, mesenteric nodes, and the urogenital tract. So treatment natin. So two factors that plays an important role in determining the prognosis of patients with infected with B. coli is the severity of infection and the patient's response to the treatment. So the medicine of choice is oxytetracycline or the terramycin and iodoquinol. Pero pwede rin po gumamit ng metronidazole as an alternative. Yan. So, kung nakikita niyo sa picture, sa slide, meron po tayong example po dyan ng oxytetracycline in injection, yan, and a tablet form of iodoquinol. Okay, so prevention and control, personal hygiene, and proper sanitary conditions. Pigs should be considered as a possible source of infection, and proper precautions should be exercised when handling and dealing with pigs and their feces. So it's very important po na yung ating mga nag-aalaga ng baboy, meron po silang protective na gamit din. So kailangan meron din silang gloves, yan, para maiwasan din po yung transmission ng parasite. Next natin, we have the Isospora belli or the Isospora belli. So, common associated disease and condition is known as the isosporiasis. So, kung titignan niyo yung picture, mukha po siyang trichuris. Pero ang pinagkaiba, mayroon dalawang malaking nucleus or vacuoles. Yan. So, size range for our oocysts, 25 to 35 micrometer long to 10 to 15 micrometer wide. Appearance is transparent. The shape is oval. Cell wall, it has 2 layers, colorless and smooth. The developing sporoblast usually is unicellular with granular cytoplasm. It has the young oocyst has 2 sporoblasts, while the mature oocyst has 2 sporocysts, each containing 4 sausage-shaped sporozoids. Yan. Laboratory diagnosis, specimen of choice, fresh feces and duodenal content. So it may contain oocysts that are immature, partially mature, or fully mature oocysts. Enterotest can be also used. So nasa picture po sa slide is an example of enterotest. So ilulunukin po ni patient yung capsule. Yan. Then, kaya po siya may tali para hihilahin po afterward. Intestinal biopsy is collected from infected patient may also reveal intracellular morphologic stages of the organism. It may also be visible in direct wet preparations and by concentration or flotation procedures. So, it appears to be transparent and may be difficult to recognize when present in saline wet preparation. So, mahalaga po na kapag magte-test po tayo or to check if the person has Isospora belli, kailangan po na hindi lang po saline wet preparation yung gagawin, pero dapat meron ding iodine wet preparation. Kasi po, transparent nga po ang itsura ng ating isospora. So, pwede po siya mapagkamalan na contamination lang. And decreased microscope light level and proper contrast is necessary. Usually, if the medtech will use zinc sulfate technique or by PVA preservation. So, tentative diagnosis, pwede rin po gumamit ng Oramin Rhodamin permanent stain for diagnosing Isospora belli. Next natin, we have the life cycle. So, the infection occurs by ingestion of sporocysts containing oocysts. The sporocysts exist, yes, nag-exist po in the small intestine and release their sporozoids which invade the epithelial cells and initiate schizogony. So, upon rupture of the schizont, the merozoids are released to invade new epithelial cells and continue the cycle of asexual multiplication. So, after that, the tropocytes develop into schizonts, which contain multiple merozoids. After a minimum of 1 week, the sexual stage begins with the development of male and female gametocytes. So once the fertilization is done, the development of oocysts are excreted in the stool. At this time of excretion, the immature oocyst contains usually one sporoblast. Okay, so ulitin ko lang po. For our Isospora belli, we have two reproduction. We have asexual first, then once na nasa inside na po siya ng body, magkakaroon po ng sexual reproduction. Yan. So, pag sexual reproduction, we have the male and female gametocytes. Okay po? Okay, so epidemiology, it is worldwide geographic distribution. Potentially false negative result is a major contributing factor to the documented rare frequency of infection. Cases can be found in Africa, Southeast Asia, and Central America. In South America, particularly in Chile, have reported Isospora belli infection. So increased infection can be found in patients with AIDS, usually because of unprotected oral anal sex. Yan, as the mode of transmission. Okay, so clinical symptoms, we have two, either asymptomatic and the isosporiasis. So asymptomatic, patient remains asymptomatic and the infection is self-limited. So nawawala din po. Unless it become an infection, so isosporiasis, the patient will experience mild gastrointestinal discomfort to severe dysentery. The patient will also experience weight loss, chronic diarrhea, abdominal pain, possible anorexia, and the patient will feel weakness and malaise. Eosinophilia may also occur. So, malalaman po siya kapag nakita po sa stool na meron siyang charcot-laden crystals. Yan. So, severe infection of isosporiasis, the patient will have a malabsorption syndrome, or it is the foul-smelling stools that are pale yellow and of loose consistency. The fecal fat levels may be increased. So, ito po yung pupo na merong pong fats kapag nilabas. So, nalutang po siya, tapos mamantika po yung dumi po ng ating patient. So, infected patients may shed oocysts in their stools for as long as 120 days. Death may occur from such severe infection. Next natin is treatment. Asymptomatic or mild infection, the suggested treatment is consuming a bland diet and obtaining plenty of rest. So, wala po muna masyadong malasang pagkain. And ang pwede lang pong kainin is yung mababilis pong i-digest. And pahinga. For severe infection naman po, it is found na chemotherapy can be used for the treatment with the combination of trimethoprim and sulfamethoxazole or by the combination of pyrimethamine and sulfadiazine. Lower dosage for a longer period may be necessary for AIDS patient kasi baka naman po, yun pa po ang ikamatay nila. Yan. So, kailangan po bawasan yung dosage pero sa mas mahabang panahon po nila ititake po ang gamot. Prevention and control. So, proper personal hygiene, adequate sanitation practices, and avoidance of unprotected sex, particularly among homosexual men. Excuse me. Next natin, we have the Sarcocystis species. So, common associated disease and condition, it is the Sarcocystis infection. So, we have 3 Sarcocystis species. We have the Sarcocystis hominis or hominis that infects cattle, and also have the Sarcocystis hominis that infects pigs, and the Sarcocystis lindemani which possible infects humans. Okay, so for our morphology, the shape is oval and transparent. The number of sporocysts inside is 2, and the size of each sporocyst is 10 to 18 micrometer long. The contents of each sporocyst is a 4 sausage-shaped sporozoids, and the oocyst cell wall appearance is usually clear, colorless, and double-layered. Okay, so laboratory diagnosis natin. Specimen of choice is stool. The oocysts are usually passed into the feces fully developed, typically seen in wet preparation. So some oocysts have already ruptured, and only the sporocysts are visible on examination on the stool specimen. So it may be singly or in pairs that appear to be cemented together. So pwede rin po na ma-detect ang sarcocystis in muscle sample, also known as the sarcocyst. Yan. Yan po yung example ng muscle na infected with sarcocystis. Okay, so life cycle natin. So, the sporocyst, katulad na nabanggit ko kanina, has 4 sporozoids inside and a refractile residual body. So, sporocyst ingested by the intermediate host, cattle for S. hominis and pigs for S. hominis, rupture and releasing sporozoid. So, the sporozoids enter the endothelial cells of blood vessels and undergo schizogony, resulting in the first generation schizoids. So these merozoids derived from the first generation invade the small capillaries and blood vessels, becoming the second generation schizoid. And the second generation merozoids invade muscle cells and develop into sarcocysts containing bradyzoids, which are the infective stage for the definitive host. Humans become infected when they undercook meat containing these sarcocysts. The bradyzoids are released from ruptured cysts in the small intestine. So these bradyzoids invades the lamina propria of the intestinal epithelium and later differentiate into a macro and micro gametocytes. So the fusion of the male and female gametes will result into the formation of oocysts. The oocysts will later sporulate in the intestinal epithelium and are shed from the host in feces. Due to fragile nature of the oocyst cell wall, individual sporocysts may also be detected in feces. So, katulad po ng Isospora belli, ang ating sarcocystis have 2 reproduction, asexual and sexual reproduction. Okay, so epidemiology frequency is relatively low. Pero ang distribution is worldwide. So it is more common in areas where livestock is raised and also found in wild animals. So tulad na nabanggit ko kanina, kasi nga ang kanyang ini-infect is either pigs or cattle. Okay, clinical symptoms. Sarcocystis infection. So the patient will experience fever, severe diarrhea, weight loss, and abdominal pain. Some are presumed that patients are suffering from muscle tenderness and other local symptoms because of its invasion of the striated muscle. So example po natin sa picture is, yan, makikita niyo po yung sarcocystis na naka-attach po sa muscle ng beef. Okay. Next po natin is the treatment. So, combined medications of trimethoprim and sulfamethoxazole or the combination of pyrimethamine and sulfadiazine. So, unlike Asporabelli, there is no known specific chemotherapy to treat sarcocystitis infection of the striated muscle when humans are the intermediate host. Prevention and control, adequate cooking of beef and pork, and proper care and disposal of animal stool. Okay. The next natin, we have the Cryptosporidium parvum. Common associated disease and condition is known as the cryptosporidosis. Okay, so morphology, we have the oocyst and schizoid and gametocytes. So for oocyst, the size is 4 to 6 micron and roundish. There is no sporocyst inside the oocyst, but sporozoites can be seen. So there are 4 small sporozoites inside a oocyst. Other features include thick cell wall, 1 to 6 dark granules may be visible. While in schizoid and gametocyte, it is 2 to 4 micron. It has 4 to 8 merozoites, microgametocytes, and macrogametocytes, and it is not routinely seen in patient samples. Okay, so laboratory diagnosis, specimen of choice is stool. Specimen for merozoites and gametocytes, we can use the intestinal biopsy material. Iodine or modified acid fast stain can be used to identify C. parvum. And the method can also use formalin fixed smear stained with GEMSA to for the detection of the oocyst. Pero mahalaga po na ma-identify po natin siya over yeast kasi magkamukha po sila, parehas po sila ng itsura. So usually po nami-misidentify ang ating Cryptosporidium parvum. So other methods that can be used for the detection of this parasite is the enterotest, ELISA, and indirect immunofluorescence. Scheiter's sugar flotation technique or zinc sulfate flotation also proven successful, especially when the sample is examined under phase contrast microscopy. Okay, so life cycle. So transmission of Cryptosporidium parvum occurs mainly through contact with contaminated water. So either drinking or recreational water. So following ingestion, yung ating sispo will undergo excistation. The sporozoites are released and parasitize epithelial cells. So makita nyo po siya sa letter B and Z, dun po sa ating drawing na galing sa CDC, of the gastrointestinal tract or other tissues such as the respiratory tract. So in these cells, the parasites will undergo asexual multiplication, and then the parasite will undergo sexual multiplication. So upon fertilization of the macrogametes by the microgametes, oocysts develop the sporulate in the infected host. So two different types of oocysts are produced: the thick-walled, which is commonly excreted in the host, and the thin-walled, which is primarily thick-walled, which is primarily involved in auto-infection. So lagi po tatandaan, ang thick-wall na oocysts is usually excreted in the host, while the thin wall is primarily involved in auto-infection. So oocysts are infective upon excretion, thus permitting direct and immediate fecal oral transmission. So, nakakahawa po agad siya kasi pagkalabas niya po sa tain ng tao, infective na po agad siya. So, worldwide distribution, food or water contaminated with infected feces is the usual mode of transmission, pero person-to-person transmission can also happen. So, people at risk are the patients which are immunocompromised, usually the AIDS patient, immunocompetent children in tropical areas, children in daycare centers, the animal handlers, and those who travel abroad. So, treatment natin, numerous experiments to treat cryptosporidium. Unfortunately, most of them have proven ineffective. However, the use of spiramycin, even though nasa experimental stage po siya, is proven helpful in reading the host of Cryptosporidium. So for prevention and control, since nakakuha po siya sa ingestion of water, proper treatment of water is needed. Handling known infected material by using gloves and wearing a gown, proper hand washing, properly disinfecting potentially infected equipment with full-strength commercial bleach, or by using 5% to 10% household ammonia. So enteric precautions when working with non-infected persons is also necessary. So next natin, we have the blastocystis hominis. Common associated disease, the blastocystis hominis infection. The name blastocystis hominis is named by Emil Brumpt in 1912. Okay, so the vacuolated form of blastocystis hominis, the size is 5 to 32 micron. The vacuole, which is centrally located, has fluid-filled structure that consumes almost 90% of the organism, while the cytoplasm appears as a ring around periphery of the organism, and the nuclei is usually 2 to 4 that is located in the cytoplasm. So, specimen of choice natin is stool. So, meron po tayong two ways. It is by using iodine wet preparation and by using permanent Yan. So, peripheral cytoplasm containing one or more nuclei appears a light yellow in color, whereas the central vacuoles does not stain and appear clear and transparent. So, permanent stain, the central vacuole may vary in its ability to stain from not at all to very apparent. So, the nuclei located in the peripheral cytoplasm typically stain dark. So, note lang natin na saline usually lyses this organism and may lead to false negative result. So, mas advisable po talaga na gumamit ng iodine wet preparation for the detection of this organism. Okay, so for life cycle, so hindi pa rin po fully understood ang life cycle ng ating blastocystis hominis. Pero what the CDC release is that blastocystis hominis reproduces by sporulation or by binary fission. So, yan. Hindi pa po siya fully understood until now. So, other morphologic forms is either amoeboid or by granular form that is noted in stool sample and or culture. Their biological role and eventual developmental fate require further investigation. So, specimen of choice, yan, epidemiology, early non-scientific documentation of B. hominis infections indicated that they are occurred as epidemics in subtropical countries. So, select articles suggest that this organism may be found in number of climates worldwide. So, usually Saudi Arabia to British Columbia. So ingestion of fecally oral contaminated water or food is the mode of transmission. Next natin, for clinical symptoms, ang infection po is known as the blastocystis hominis infection. The pathogenicity is not clear, but symptoms have been defined. So the patient are usually experiencing diarrhea, vomiting, nausea, fever, abdominal pain, and cramping. So the treatment that can be used is either iodoquinol or metronidazole. While the prevention and control, so proper treatment of fecal material, thorough hand washing, subsequent proper handling of food, and water. Okay, so next natin, we have the Cyclospora cayetanensis. The common associated disease and condition is known as the Cyclospora cayetanensis infection. Morphology. So the Cyclospora cayetanensis mature oocyst is usually 7 to 10 micron in diameter. It has two nuclei, and the contents of the sporocyst, each sporocyst contains two sporozoites. Tama. Sorry, number of oocysts pala. Sporocysts inside is 2. Yan. Okay, so specimen of choice, concentrated stool. The oocysts sporulate best at room temperature. Ibig sabihin po, nagba-binary fission na nagdi-divide po ating organism in room temperature. So 5% potassium dichromate allows the sporocyst to become visible. Rotation methods followed by examination using the preferred phase contrast or bright field microscopy have also proven successful. And modified acid pastain may also be used. And the oocysts of this organism can autofluoresce under ultraviolet light microscopy. So for our life cycle, in environment, sporulation occurs after days or weeks at the temperatures between 22 to 32, resulting in division of the sporont into two sporocysts, each containing two elongate sporozoites. So the sporulated oocysts can contaminate fresh produce and water, which are then ingested by humans. So once the oocysts exist in the gastrointestinal tract, the sporocytes will invade the epithelial cells of the small intestine. Inside the small intestine, these cells will undergo asexual multiplication. Then, as the fertilization occurs, the zygote develops into an oocyst, which is released from the host cell and shed in the stool. So several aspects of intracellular replication and development are still unknown, and the potential mechanism of contamination of food and water are still under investigation. So katulad po ng mga nauna nating organism, ang ating Cyclospora cayetanensis has two reproduction. It has sexual and asexual reproduction. So it is found in United States and Canada. It is also reported in children living in unsanitary conditions in Lima, Peru, travelers and foreigners residing in Nepal and parts of Asia. So there are also reported cases. The first one is the mini outbreak in Chicago in 1990 that happened in a physician dormitory, and contaminated lettuce and fresh fruits such as raspberries have also caused infection due to this organism. Okay, so clinical symptoms, the Cyclospora cayetanensis infection produces longer diarrhea in adult, and in children, similar yung kanyang symptoms in cryptosporidiosis. So prevention and control, properly treating water prior to use and only using treated water when handling and processing food. So we have the Toxoplasma gondii. So common associated disease and condition, the toxoplasmosis, congenital toxoplasmosis, and the cerebral toxoplasmosis. Yan. So, ating first morphology, we have the tachyzoids. So, they are actively multiplying morphological form of this parasite. So, it is usually 3 to 7 by 2 to 4 micron, and shape is crescent shape, often more rounded on one end. It has one nuclei, and other features contains a variety of organelles that are not readily visible. So, ito pong ating Toxoplasma gondii trophocyte, madali po siyang makita kasi siya po ay crescent shape. For our bradyzoids, they are the slow-growing morphologic form of Toxoplasma gondii. So, they are usually smaller than tachyzoids. Physical appearance is same, pero po, ang ating bradyzoids has hundreds to thousands of bradyzoids enclose themselves to form a cyst that may measure 12 to 100 micron in diameter. So, nagkukumpul-kumpul po siya. Yan. So, hundreds to thousands po. So, laboratory diagnosis. Primary means of diagnosis is by the use of blood samples using serologic test methods. So, the recommended test for the determination of IgM present in congenital infection is the use of double sandwich ELISA method. The IFA can detect both IgG and IgM antibodies, while the EHA and ELISA can only detect IgG determination. So tissue biopsy can also be used because it can demonstrate trapezoids and cysts filled with bradyzoids. So the life cycle, the only known definitive host for Toxoplasma gondii are the family of cats, or the Felidae, family Felidae. So unsporulated oocysts are shed in the cat's feces. So the oocysts are usually shed for 1 to 3 weeks. Large numbers may be shed. So oocysts take 1 to 5 days to sporulate in the environment and become infective. So in the intermediate host in nature, including the birds and rodents, become infected after ingesting soil, water, or plant material contaminated with the oocyst. Oocysts transform into tachyzoids shortly after ingestion. So these tachyzoids localize in neural and muscle tissue and develop into tissue cyst bradyzoids. So the cats become infected after consuming intermediate host harboring tissue cysts. So usually po pag kumain po ang pusa ng daga na infected with this organism. So the cats may also become infected directly by ingestion of sporulated oocysts. Animals bred for human consumption and wild game may also become infected with tissue cysts after ingestion of sporulated oocysts in the environment. Excuse me. So humans can become infected by any several routes. So either eating undercooked meat or animals harboring tissue cysts, consuming food or water contaminated with cat feces, or by contaminated environmental sample, blood transfusion or organ transplantation, and it can be transmitted transplacentally from mother to fetus. Okay, so in the human host, the parasites form tissue cysts, most commonly in the skeletal muscle, myocardium, the brain, and eyes. These cysts may remain throughout the life of the host. So diagnosis is usually achieved by serology, and although tissue cysts may observe in stained biopsy specimen. So diagnosis for congenital infections can be achieved by detecting Toxoplasma gondii DNA in amniotic fluid using molecular methods such as polymerase chain reaction, or PCR in short. So epidemiology natin, found worldwide. Definitive hosts are the cats. Most important populations at risk for contracting this parasite is individuals suffering from AIDS. So documented reports so that Toxoplasma gondii occurs in 15 to 20% of the population in the United States. Infection caused by the consumption of undercooked meat and its juices by women and their children in Paris was reported in 93% and 50% of the local population. Bakit po? Kasi mahilig po sila kumain ng raw meat. Medium rare o kaya rare. Yan. So, hindi po properly cooked. So, yan. So, nai-infect po sila ng Toxoplasma gondii. Estimated 4,000 infants born with transplacentally acquired infection in US each year, and mature oocysts are incredibly hardy and can survive for long periods under less than optimal conditions. So, kaya po nila mag-survive ng matagal. So, clinical symptoms. Marami po kasing klase ng sakit ang kinokos ng Toxoplasma gondii. So, isa na po doon is yung asymptomatic infection. So, the patient may remain asymptomatic. Usually, the children who have passed the neonatal stage of their lives. Toxoplasma gondii appears to only cause disease in humans when one or more of the following conditions have been met. So, the virulent strain of the organism has entered the body. The patient is susceptible, so usually the AIDS patient, and the specific site of the parasite in the human body is such that tissue destruction. So the first disease or condition we have is the toxoplasmosis. So typical symptoms experienced by the individuals are mild and mimic those seen in infectious mononucleosis. So, in acute toxoplasmosis, the patient will experience fatigue, lymphadenitis, chills, fever, headache, and myalgia. While in chronic infection, the patient will have maculopapular rash, evidence of encephalomyelitis, myocarditis, and or hepatitis. Retinochoroiditis with subsequent blindness has been known to occur in rare occasions. So, pwede pong mabulag ang patient na meron toxoplasmosis. Next natin is the congenital toxoplasmosis. So, transmission of this disease occurs when the fetus is infected unknowingly by its asymptomatic infected mother. So, the degree of the severity of the resulting disease varies and is dependent on two factors. So, either antibody protection from the mother and the age of fetus at the time of infection. So, mild infection occurs occasionally and result in what appears to be complete recovery. Pero usually, ang congenital toxoplasmosis has the symptoms including hydrocephaly or mas maliit pong ulo, microcephaly, intracerebral calcification, chorioretinitis, convulsions, and psychomotor disturbances. Most of these infections, severe visual impairment or blindness can also occur. Next natin, we have the toxoplasmosis in immunocompromised patients. So, these are the patients that are immunosuppressed because of organ transplantation or the presence of neoplastic disease such as Hodgkin's lymphoma, and also the patients who needs blood transfusions. So, last natin, we have the cerebral toxoplasmosis in AIDS patient. So, the patients experience early symptoms of headache, fever, altered mental status, and lethargy. Subsequent focal neurologic deficits, brain lesions, and convulsions may also develop. So, the Toxoplasma gondii do not spread in other organs of the body but rather stay confined within the CNS. Kaya nga po siya tinawag na cerebral toxoplasmosis. Sabihin po sa utak. Yan. So, high spinal fluid IgG and antibody levels is diagnostic as well as demonstration of tachyzoids in the cerebrospinal fluid. So, most infected patients do not have serum level of IgM antibodies. So, the lack of serum IgM coupled with the lack of change in serum IgG levels occurred because of reactivation of a chronic latent infection and not because of an acquired primary infection. So, pwede po pala na maging mababa po yung level ng IgG, IgM kapag nag-reoccur po yung infection. So, next po natin is the treatment. So, the treatment of choice is the use of triazolapyrimidines and the pyrimethamine or under the name Daraprim. So, infected pregnant women should not be given pyrimethamine. So, alternative drug is the use of spiramycin. So, folinic acid or leucovorin may be administered to AIDS patient to counteract the bone marrow suppression caused by pyrimethamine. So, the Atavacon is the treatment of toxoplasmic encephalitis in patients with AIDS. So, yun po yung example nasa slides po. Prevention and control, avoidance of contact with cat feces. So, kapag magtatapon po or maglilinis ng cat litter box, wear protective gloves when cleaning out cat litter box, disinfecting the litter box with boiling water, and thorough hand washing afterward. So, placing a protective cover over children's sandboxes when not in use to keep cats from using them as litter boxes. Avoidance of ingesting contaminated meat, keeping cats away from potentially infective rodents, feeding cats only dry or cooked canned cat foods, and not having cats at all. Bad naman. Mag-alaga pa rin po tayo ng cats. I-love nyo po si Nanoya. Yan. So, ang mahalaga lang naman po is yung proper waste disposal ng kanilang pupo. Yan. So, always remember na mag-wear ng protective gloves kapag mag-handle ng cat litter box. So, last natin, we have the pneumocystis jirovecii or carinii. Common associated disease and condition names is the pneumocystosis, atypical interstitial plasma cell pneumonia. So, yung example po, picture sa baba. Yan. For morphology, the trophozoites is 2 to 4 micron. The shape is usually ovoid or amoeboid, and it has only one nuclei. While the cyst of the pneumocystis jirovecii, it is 4 to 12 micron, and the shape is roundish and has 4 to 8 nuclei, unorganized or arranged in a rosette form. So, mukha pong bulaklak. Laboratory diagnosis, the specimen that can be used are the sputum, bronchoalveolar lavage, tracheal aspirate, bronchial brushings, and the lung tissue. Gemcine iron hematoxylin stain may also be used, but the Gomorrhea methenamine silver nitrate stain it has successful diagnosis usually done using histologic procedure. So, pwede rin po gumamit ng monoclonal immunofluorescent stain. Life cycle, still considered as unknown. So, wala pa rin pong proper or tamang life cycle for this parasite. So, it is presumed that once inside the alveolar spaces in the lung tissue, the mature cyst rupture, producing actively growing, multiplying, and feeding trophozoites. Then, these trophozoites eventually convert into precyst and cyst, and it can be found in multiple body sites, including the spleen, the lung, the lymph nodes, and the bone marrow. Epidemiology, prevalent in many parts of the world, usually in United States, Asia, and Europe. So transmission is via pulmonary droplets through direct person-to-person contact. So at risk, AIDS patient, malnourished infant, and those with predisposing conditions such as malignancy. So pneumocystosis, or the atypical interstitial plasma cell pneumonia. So suppressed adults and children are usually at risk with non-productive cough, fever, rapid respiration, and cyanosis. So, cyanosis yung nababawasan po or lack of oxygen. So, ang patient po ay nagiging blue in color or bluish color. So, interstitial plasma cell pneumonia is the leading cause of death in AIDS person infected with P. girovechi often also suffer from Kaposi's sarcoma. So, kung nakikita niyo po yung picture, it's a picture of X-ray of lungs. So, the first one, the left X-ray is a normal chest X-ray, while the other one is the one with the pneumocystis infection. So, infected, malnourished infants experience poor feeding, loss of energy, rapid respiration rate, and cyanosis. Onset is longer, lasting several weeks. So, all infected patients typically exhibit an infiltrate on chest X-ray. Breathing difficulties may low in PO2 and a normal to low PCO2. So, prognosis is usually poor. Lack of oxygen and carbon dioxide exchange in the lungs is the primary cause of death. So, alam naman natin ang pneumonia po ay nakamamatay po kapag hindi po nagamot agad. So, treatment po, the trimethoprim sulfamethoxazole under the brand name Bactrim is the first line of treatment of infection with P. girovechi, while the pentamidine, isethionate, and cotrimoxazole can also be used as an alternative drug. So for our prevention and control, it is important the patient, the medtech or the doctor or the nurses have mask worn around known infected person. Kasi nga po, ang ating pneumocystis jirovecii can be transmitted by person to person through droplets. And so, tapos na po tayo ng lecture natin. So, ito na po yung final and last lecture natin for our final period. Sana po may natutunan po kayo. Yan. So, ingat kayo palagi. Stay at home. Bye-bye.